Thank you so much, Cherise. We will now move on to our dental with Alan from Delta.
Yep, I'm here.
Okay.
All righty. Give me just a second. Hi, everyone. I want to introduce myself. My name is Alan Marslak, and I have been working with the county as your account rep for Delta Dental, and I've been working with the county for about 8 years now, so very familiar with the plan. Through my presentation, if you have any questions or anything that you want to ask, please feel free to put that in the chat. If there's anything that's a little more personal that you do not want to put in the chat, please feel free to reach out to your HR contact and have them provide my information so that we can jump on a call if there's anything you do not want to share in the presentation. So I am going to turn my camera off and share my screen if I can get a thumbs up from somebody if it once it comes through. Somebody confirm that it's
You're there.
All right, perfect. So I'm going to start. So a little bit of the agenda today is we're going to talk about the plan options we have available for you. I'm going to go over our network and hope to provide a better understanding when choosing a provider for services. We're going to go over some product updates. Now, some of these aren't updates, they're just reminders of what's available to you that Delta Dental has incorporated. And then we're going to talk about some of the member tools and resources that are available to you that will better help you utilize your benefit. So one of the plan options we have for you is our Delta Dental PPO standard. And I'll go into that a little bit more later when we have a payment example on why you should choose which provider and which network. But when you're looking at that, if you do decide to look for a new dentist, I'd highly recommend looking for a PPO provider. Although you can seek services at any provider, your out-of-pocket costs are going to be lower and your savings are going to be a little bit higher when searching for services at our PPO provider. If you are seeking services at a PPO or Premier provider, Delta Dental will pay all of the claims directly to those providers. There's no need for you to fill out any paperwork or for you to do anything yourself. As soon as that provider provides those services, we will pay them directly. We also have an EPO plan, which is our exclusive provider plan. This is a closed panel network of dentists. So if you are enrolled in this plan, I want to stress the importance that you do search for an EPO provider. Otherwise, we will not pay for any of the services provided. Again, those providers in our EPO network are paid directly, so there's nothing for you to submit when having services done. Now, our Delta Dental networks. Delta Dental has two networks. We have a PPO network and we have a Premier network. And the importance of that is due to your plan design, we're going to pay the PPO fee schedule across the board, which is why I stress the importance of seeking services at a PPO provider. Our network is wholly owned. None of it is leased, so we control all of the fees across the board with all of our providers. They agree to our discounted amount in services, and they agree to additional protections for the member within the contract. Now, 89% of all licensed providers in the state of Michigan participate in one of our networks. With that being said, especially if you're looking for services in Southeast Michigan, we have a large saturation of PPO and Premier providers. So you shouldn't have an issue, searching for a provider within close proximity to your home or your workplace. And this is, what I wanted to stress the importance of seeking services at a PPO provider if you're part of the PPO standard plan. If you look at that submitted amount in the first row, the submitted amount, whether it's a PPO Premier or non-PAR, is $1,000. Our approved fee for that service at a PPO provider, $610, Premier providers $840, and the non-PAR, because they have no contractual agreement to accept our fees, is still $1,000. Now, what I said earlier is we're going to pay that PPO fee amount across whether you're seeking services at a PPO, Premier, non-PAR. As you can see, that third row, the agreed fee is $610 with a PPO provider, a Premier provider, or a non-PAR provider. That's covered at 70%. So covered at 70%, Delta Dental is going to pay $427 whether you seek services at a PPO, Premier, or non-PAR. And so like I said, your out-of-pocket costs are going to be less because you're not paying the difference between those agreed fees and our allowed fees. So again, stressing the importance, if you're not tied to a provider already, or you're looking for a new provider, I'll show you how to look for services or a new provider within your area in our PPO network. This is how you're going to find a dentist. And there's a couple ways to do this, and I'll provide some more examples later on. But one of them is our deltadentalmi.com/find-a-dentist website if you're on the PPO plan. And then we do have this link right here for our Delta Dental EPO. And when you go to the deltadentalmi.com website, there's also a link in there to find a PPO provider. If you do not have access to a smartphone or a computer, you can also call our customer service number which has non-standard hours, and they can assist you in finding a provider within your area. Now, when you go to our website, you're going to find in the top corner or in the center of the page, there's a Find a Dentist link. When you click on that, it's going to take you to this next page. To the right, you'll see that Delta Dental EPO. If you're under the EPO plan, that's what you're going to want to click to find a provider. If you're with the PPO standard, you're going to want to click this Delta Dental PPO and Premier link. And from here, it's going to provide this screen, which has a drop down. And it's going to allow you the option to click PPO or Premier. Like I said, if you're not tied to any dentist right now, you can click the Delta Dental PPO. And if needed, if you're looking for a specialist of some sort, or if you're just looking for a general dentist, you can click on specialty, and it'll provide options for orthodontists, oral surgeons, periodontists, endodontists. So you have all those options available to you, but by clicking on the PPOs where you're not going to have any additional balance billing. And then from here, you can click a dentist, a distance, whether it be 5 miles, 10 miles, 15 miles from a specific address. And that address could be your home or your place of work, if whatever works out best for you. And it's going to provide you with a list of providers in that PPO network. And then it's also got a map, so you can get a general idea of where that location is in proximity to where you're searching or where you are. And then some of our product updates. Like I said, this isn't necessarily a new one. I think it's more of a reminder of what's available to you. And back in 2024, Delta Dental changed their frequencies on occlusal guards or bite guards. And this, assists with grinding your teeth when you sleep. Previously, it was payable once per lifetime. Now that Delta Dental is paying for it once every 5 years, if you are in need of, on a new occlusal guard that needs repair, or it's, you're just ready for a new one and you've passed that 5-year frequency, this is available for you. And then also, just a reminder of our enhanced benefit for vulnerable population. So what this is, and I believe there was a question earlier if there's coverage for autism. This is an additional benefit for those with qualifying special health care needs. Dentistry for somebody with some type of cognitive or physical disability, might be an issue or might be hard so much so that some people can't even go to the dentist because of these. Well, what this does is this covers additional benefits that aren't normally covered. And all your provider needs to do is submit, there's a dental code for this, and our providers are educated on this dental code. So all you got to do is let them know, I require this, and it'll provide such things as, additional cleanings or sedation for dental work, which is not normally a covered benefit. But with this, when submitted in conjunction with that special healthcare needs dental code, it will provide that sedation and those additional services that are required covered at 100%. If you require additional information, please feel free to reach out to your HR contact, and I can provide flyers and additional information regarding that. And then here's some of the member resources and tools that are available to you. So our customer service, like I explained earlier, they have non-standard hours, Monday through Friday from 8:30 a.m. to 8 p.m. And they can assist you with a handful of things, whether it be finding a provider or a question on the claim. And over 99% of our calls are first call resolution. So they're going to get you an answer to your question or your issue on that call. We have our member portal mobile app, our Delta Dental Automated Service Inquiry or DAISY line, which that's if you're traveling abroad and our customer service is close. You can call that if you have questions on your benefit or, to verify eligibility. Maybe you need emergency services, and you can verify that through this. And then our website, deltadentalmi.com. So our website, mi.com, deltadentalmi.com, provides oral health articles and videos, wellness material. You can find a dentist. You can actually refer a dentist. If you are seeking services at a provider, you currently are seeing a certain provider, and you want them to join our network, you can actually go to our website, provide your dentist information, and submit that. And our provider relations team will reach out to that provider to see what options we have available on them joining our network. And then our member portal and our mobile app. Our member portal and our mobile app will provide a lot of the same information, whether it's information regarding your plan, pulling EOBs, provide a digital ID card. I will say this. I think the member portal is a little bit user friendly, so I would push for anybody that's looking to sign up for one of those to try or to use our member portal. And the interface is the same whether you're using a laptop, a tablet, a smartphone. So our member portal, this is our portal that will help you utilize your benefit. When you log into the member portal, you click on your coverage, it's going to give you a outlay of what your benefit is. And then if you click on your routine procedure eligibility, it's going to provide your last three services right here. So it's going to tell you what the dentist was, your coverage, and what those services were. Also from the member portal, you can print a digital ID or print an ID card. As you know, if you've been enrolled in the plan for a while, an ID card is not required. But if you for whatever reason you would like to have an ID card printed, you can do that from the member portal. Seeking services, your provider's probably going to already have your.
Someone needs to mute
Say one more
their mic.
time. That's working with in the front office. Yeah.
Okay, sorry about that.
Yep. So if you've been seeking service as a provider, all claims are submitted through the member's social security number. And then if you're like me, if you need an EOB at a later date, whether it be for HSA or anything like that, or for tax purposes, you can in the member portal, you can pull up all of your previous EOBs for services that you've had done that year. Now, Delta Dental currently mails out EOBs as soon as a claim is processed. You should receive that within a few days after you've had that claim submitted to Delta Dental. If you prefer not to have those EOBs mailed to you, you can go onto the member portal and update your paperless preference so that these are only available digitally and we will not mail those out anymore. And then also, just like our deltadentalmi.com website, you can locate a provider, and the interface is pretty similar to what we have on our state website. You can search by a provider in proximity to a specific location, and search those by specialist or just general dentist, and it's going to give you a list of providers with that meet that criteria within that proximity, whether it be 5, 10, or 15 miles from a specific address. Does anybody have any questions? Was there any in the chat, Deborah?
Yes, Alan, there's a few in the chat.
Okay.
Let's see. So Deborah wanted to know if Wayne County's Delta Dental plan is a PPO or Premier plan, and it is a PPO plan.
It's a PPO plan. Now, they can seek services at PPO Premier, whatever they need be, but we're going to pay that PPO fee. I'll go back to the payment example page right here. So you can seek services at a PPO Premier or non-par. If you seek services at a Premier, they still have to accept our agreed fee, which you can see is lower than the submitted fee. But again, we're going to pay that PPO fee schedule, whether you're seeking services at a PPO Premier or non-par dentist, which is, why I stress the importance of seeking services at a PPO provider.
Okay. Margena wanted to know how to access the Delta Dental provider information in a PDF format. I'm assuming that's what you mean.
Yep. So from that website that I showed you earlier, if you right here. So after you search on our website or through the member portal, there's going to be options in the right-hand corner if you want to open up a PDF of the provider listing or the providers that you searched. You can do that in the top right corner of the Find a Dentist option, or you can have those providers emailed to you.
Okay. Sandra wants to know how much is the maximum funding available per year for spending from the dental carrier?
So your plan design, it has 1,000 annual max and then 1,000 lifetime ortho max. That the annual max will reset every year 1/1. The ortho max is available, it's once per lifetime. So once that 1,000 is used up for the ortho, that is it. Now I will say this, if you are seeking services, at a in-network provider and you use up your full annual max or your ortho max, if you're still seeking services in network, you may not have any annual max available to you, but those providers in network are still agreed to accept our fee. So, let's say you're going to get a filling and that filling is $250, but our agreed fee is $160. Even though the plan's not going to pay any, you're still only going to be charged that $160, if that helps.
Okay. Sandra stated that Delta Dental needs to break out PPO and Premier to make it easier or to keep you from making a costly mistake.
Yep, it's part of your plan. That's why I try to reiterate on all these calls, to seek services at a PPO provider. Now you have that Premier network available to you for additional protection, but your least out-of-pocket costs and your annual max is going to go a little bit farther with additional savings at our PPO providers.
Okay. Paula stated, do you need the Premier plan for the vulnerable population services?
Nope. So there's not between our PPO and Premier network, there's not a difference in our quality of care. It's the savings and reimbursement is a little bit higher with our Premier providers. So you can seek services for the enhanced benefit at a PPO provider as well.
Okay. Sandra wants to know, please provide additional information regarding the enhanced dental benefits available.
Yep, I will send you additional information, Deborah, that you can provide to your members.
Okay, thank you. And Cassandra wanted to know, can we access the provider search prior to enrollment, and if so, how?
Yep, you don't need to log into our website when searching for a provider. If you go to the deltadentalmi.com website, and then this scan is additional resources as well for your members. That's why I have that up on the screen, but you do not need to be enrolled in the plan to search for a provider.
Okay, very good. Cheryl wants to know, for Delta Dental, if you have your own Delta Dental coverage and a secondary Delta Dental coverage, such as through your spouse, do both plans pay toward a dental service, or will only one of the Delta Dental plans pay?
So that's sort of a odd trick question, but yes, in short, yes, it will. If you and your spouse are both employees of Wayne County and you both have a plan, the benefits will not coordinate. Now, if you have the plan through Charter County of Wayne and your spouse or significant other has another plan, whether it be Delta or another carrier outside of Wayne County is set up that it'll approve those coordination of benefits. You just need to confirm that your spouse's coverage also allows for coordination of benefits. And I can provide you with a flyer for that as well.
Okay, please. Okay. Sandra states, with costs going up all the time, will they increase the annual maximum benefit? That's something I do know that the leadership staff has been discussing, but it's not going to change for the 26 plan year. Jacqueline, for Delta Dental PPO, the listed patient pays $183. Is this the annual cost or a bi-weekly cost? That's what Delta Dental, I believe, is paying out. Is that you're trying to find out?
Yeah, I'm confused on the question.
Yeah, I think she's confusing the two things. You had a screen, I believe, that was up that talked about costs, and I think she's actually asking a question about what the cost we pay as employees for the plan. Is that what your question is, Jacqueline? If so, the rates for the plan will be loaded on the benefits website. Cassandra said, can you post the link to access the provider list again? She wants the link again.
DeltaDentalMI.com, and on the first page there should be click the find a dentist option.
Okay. Alan, can you go back to, I think what Jacqueline was looking at was the slide that, yes, I think, is this the slide? No, I don't think that's it.
So that's your patient.
Yes, it is right here.
183 is your, the 183 is your patient responsibility. So for instance, if you're seeking services at a PPO provider, the submitted fee is $1,000. Our agreed fee at a PPO provider is $610. So the provider cannot charge you more than $610. With that being said, this is just an example. It's covered at 70%. So the plan's going to pay the 70% of 610, which is 427, and your out of pocket is 183. And this is just a this is just a general payment example. It's not an example of a actual claim or your coverage in general. It's just showing you the difference in savings, whether you're going to a PPO, Premier, or non-par provider.
Jacqueline, does that answer your question? Okay, yes, that answered it for her. Okay, thank you. I don't think I missed anybody in the chat this time. So I think that's it. Thank you so much, Alan. It's good to have you.
Thank you. And I was just going to say, like I said, if there's anybody who has any more personal questions that they don't want to share in the chat or questions outside of this, please feel free to give my contact information. I'll be glad to jump on a call with them if needed.
Okay. We will. Thank you. We're going to move forward with DenCap. They're here to present for us.
All right. Good morning. My
Good
name is
morning.
Serena, and I am here. Thank you for allowing me to present for DNCAP today. If anyone has any questions, please feel free to put them in the chat, and I'm going to go ahead and get my slides up. All right. Can everyone see my slides?
Yes.
Thank you. Alrighty. We are excited to be here and talk about dental benefits. This is DenCap's 41st year of providing dental insurance for Wayne County employees, and we are happy to do so. During open enrollment this year, we are again offering two plans, the Smile Guard and Premier. We'll talk more about the differences between the plans in a moment. Remember, we are a DHMO, which means you must see a dentist in our network. You'll also receive a schedule of benefits and fixed co-payments, which means there will be no surprises around your cost of treatment. When it comes to your oral health, be your own advocate. You can ask for a written treatment plan and feel comfortable to ask questions, including if there are alternative treatments. The first of our two plans is SmileGuard. SmileGuard is a full coverage dental plan. It includes 100% coverage for preventive services such as cleanings and checkups. It also covers 50% of major treatments like fillings, crowns, root canals, and dentures. We offer $1,250 annual maximum for general dentistry. Specialty care like oral surgeons or periodontists is covered up to $500. Orthodontic coverage is also included with $1,800 of coverage for those under the age of 19 and $1,500 for adults up to the age of 19. 19 and up. The Smile Guard plan was designed to give you a peace of mind. You can think of it as your safety net for those times when you expect a standard checkup but end up needing more work done. It offers balanced protection for routine care and is ideal for employees who want solid coverage without surprise dental bills. The Premier Plan is our newest dental option that provides the highest maximums in orthodontic coverage offered to you and a buy-up option. It has better coverage, like 85% of the cost for fillings and root canals, and covers 80% for major procedures like crowns, partials, or dentures. You have a $3,500 maximum for general dentistry, a $1,000 maximum for specialty care, and ortho is covered at $2,000 for children up to the age of 19 and $1,200 for adults over 19. The Premier Plan is designed for members who want the highest level of coverage available. It's ideal for anyone who wants peace of mind before their next dental visit, especially if you anticipate more extensive dental work. The best part is that the plan starts at $12.50 per month for single coverage, $45 per month for two people, and $80.50 per month for a whole family, giving you enhanced coverage for a reasonable price. Since we are a DHMO plan, it is important to stay in network to ensure your services will be covered. If seen out of network, you will be responsible for the services rendered. If you are concerned that you may have a dental emergency at some point when you are not near your dentist, reimbursement for treatment you may need to help relieve you of any pain you might be in. Currently, we have 190 general and specialty offices in our network. Some are private practices and some are larger chains, but all are easy to find and offer quality care you can trust. We've made finding a dentist near your home or work simple. Please call us or visit our website at dencap.com. We want you to make the most of your dental insurance. You can do this by knowing your plan. Review your schedule of benefits so you'll always be aware of your out-of-pocket costs. Scheduling regular checkups can save you money in the long run and help keep your smile healthy. If you're someone who needs a lot of treatment, we have you covered with a high maximum, so be sure to utilize it. If you happen to reach your max, it will restart again in 2027. We issue ID cards, and new enrollees will receive them at the end of 2025. ID cards also come along with a schedule of benefits to prepare you for your dental visit. Your ID card will include plan information and also who's covered. Okay, so I'm sure everyone on this call has contacted a service provider at one point or another and was placed into an automatic call tree. Well, not at DenCap. Our customer service is live and local, which means you will never be placed into a call tree and will reach a friendly, knowledgeable rep each time you call for assistance. Here are a few common questions we receive. Members often contact us regarding billing and if changes to their dental location can be made. If you have any more questions outside of what's on your screen, please don't hesitate to reach out and we will gladly assist you. Thank you for your time. It has been my pleasure to present for DenCap today. And you all have a great rest of your day.
Thank you, Serena. We have